Good morning. National Institute for Research in Tuberculosis, known as the TB Research Centre, is an internationally recognized centre for TB research and control under the Indian Council of Medical Research. Since its inception in 1956, under the auspice of World Health Organization, the Indian Council of Medical Research, British Medical Research Council and the Government of Tamil Nadu, the institute has evolved in many ways. Not only in its name, from TB Chemotherapy Centre to TB Research Centre and now to the National Institute for Research in Tuberculosis, the institute has grown in many ways, both in terms of generating evidence in the fight against TB as well as in the development of newer technologies. Over the years, NIRT continues to remain as the core facility for TB research and control in the country. As more and more evidences get generated from the research conducted at the institute, many of them get implemented as TB guidelines into the TB program and TB policies. It is mandatory for the treating physicians in the country to keep themselves updated with the latest in the TB treatment. NIRT along with NPTEL has come up with a new online course called the TB Manage or Manage TB online course, which incorporates all the newer evidences in line with the TB treatment guidelines in the country. We expect this online course to be beneficial to the participating as well as the practicing physicians in the day-to-day practice of TB patients and the management. I take this opportunity to wish the NIRT team, faculty and the participants all the very best in taking part in this online course and getting the maximum benefit out of this course. Thank you.
Tuberculosis, as we all know, though an ancient disease, has remained with us and in fact has changed in its scope and in the way it affects people and in the potential for transmitting drug resistance and so on. And therefore, there needs to be a concerted effort for us to work in unison if we are going to eliminate tuberculosis in the next 5 to 10 years. There have been a lot of developments recently, both in terms of new diagnostics and in terms of treatment strategies, as well as more knowledge now on the basic pathogenesis of tuberculosis and what is really needed in order to ensure timely diagnosis as well as correct management of each and every individual patient. So this course has been put together drawing upon the combined expertise of a large number of very experienced and senior professionals in the field in order to give doctors who may be working in the private or the public sector an opportunity to learn about tuberculosis and all its nuances and the recent advances in a format that is easy to access from wherever they are. So this online course, which has been developed by the National Institute for Research in Tuberculosis in partnership with a number of other bodies and agencies, hopes to fill a void in this space as there was no such training material available so far for people to access. So I hope that this is going to be a useful exercise, that this course would really add to the knowledge about tuberculosis and lead to its better management in the community. And I wish both the institute as well as all the doctors who are going to take this course all the best and hope that together we can fulfill this goal of TB elimination in India.
The National Institute for Research in Tuberculosis, or NIRT, formerly known as Tuberculosis Research Centre or TRC, is one of the institutes of the Indian Council of Medical Research. Since its inception in 1956, this institute has done pioneering research in the field of tuberculosis, which have helped to formulate the guidelines for management of TB. Keeping in mind the need for increasing the knowledge base for management of tuberculosis, the NIRT, in partnership with NPTEL of IIT, has launched an online short course on management of tuberculosis.
We are all aware that tuberculosis is a major public health problem in India. Earlier, it used to take weeks to months for diagnosis of tuberculosis and for drug-resistant tuberculosis. With the newer diagnostic technologies, this time has been reduced to a few hours or to 1 to 2 days only. The advent of gene expert is a game changer in this context. Early diagnosis, as we are aware, is of course a prerequisite for early and appropriate initiation of treatment. This leads to better treatment outcome and also helps in cutting the chain of transmission of tuberculosis in the community.
Even though TB continues to be a major public health problem today, we have treatment regimens that can cure more than 90% of patients with drug susceptible TB. The currently recommended treatment regimens have evolved over many years as a result of clinical trials done in India and abroad. However, due to the long duration of treatment that is required by a minimum of 6 months, it is equally important to ensure that the patients complete the full course of treatment without interruption. The Managed TB online course for doctors is a felt need at this time in our efforts to control TB and reduce its impact in the community.
While the principle of treatment of extrapulmonary TB is same as that of the pulmonary TB, there are some special consideration when dealing with the former. Then the most important thing is paradoxical reaction. So, this is an immune dysregulation which happens in all immunosuppressive patients, especially nowadays with HIV, but it can happen in all other groups of patients who are immune suppressed. The physician treating the TB patient should be aware of the guidelines which have now been given by the National TB program that are now available with him, so that he can assure a best possible care to his patient where he deserves.
Childhood TB presents many challenges to the physician, both with respect to diagnosis and treatment of the disease. Though in principle it remains the same disease process as in adult, but there are some special considerations which require attention. Diagnosis in children is often hampered by difficulty in obtaining specimen. Doctors dealing with pediatric TB therefore need to be aware of the difficulties in diagnostic approaches, the newer developments which have happened in diagnosis, and changes in the treatment schedule which have happened in the recent past. I sincerely believe that Managed TB online course for doctors will fill up this important gap, and it is a welcome initiative in this direction.
Any provider dealing with a patient of TB has a public health responsibility. Therefore, the knowledge of agent, host and environmental factors related to disease causation help you to render appropriate advice in prevention of transmission and disease development. It also helps you to identify the group of people in which you should actively look for and rule out tuberculosis. Knowing about the disease situation and its trends, including the impact of interventions like RNTCP, will also help to make any course correction aimed at reducing the burden of TB.
This course is very useful for doctors in that it has a very holistic perspective in the way it is designed. It is not only focused on medical and laboratory and basic science issues, but it also captures the social barriers, the social issues that need to be addressed if one needs to talk in terms of TB control.
Despite all our efforts that we have been doing, TB continues to pose a very formidable challenge for all of us and to the whole public health systems in general. And we need to also expand our diagnosis and treatment network with services being made available with newer tools and strategies. Needless to say, we as physicians have to make ourselves very well aware of this particular challenge of tuberculosis, and we have to play the key role as much in this whole national endeavor of TB elimination.
This online course on tuberculosis conducted by the National Institute for Research in Tuberculosis is open to all physicians who wish to update his or her skills in the management of tuberculosis. The curriculum has been carefully planned, keeping in view the latest developments in the field of diagnosis and treatment of tuberculosis, and the curriculum has been approved by a panel of experts from the field of academia, research and TB control. The topics which will be covered include epidemiology, pathogenesis, diagnosis, treatment and prevention. Special emphasis will be laid in the management of drug-resistant tuberculosis, in comorbidities, monitoring of adverse drug reaction and infection control strategies. The program has been designed in such a way that the practicing physician can complete the course at his own convenience in the stipulated period. The National Institute for Research in Tuberculosis invites all doctors to enroll in this unique program and ensure that they give quality care to tuberculosis patients.